We are going live on Facebook now, Paul.
Okay, thank you. Good afternoon, everyone. As always, before we get started, we have a quick message for our Spanish-speaking viewers. Gilbert, you want to help us out with that?
Hola, buenas tardes y bienvenidos a la sesión informativa donde la doctora Mase nos dará una actualización sobre el coronavirus. Esta actualización se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias.
Thank you, Gilbert, and thank you all once again for joining us. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 community briefing for Friday, November 13th. This is our community briefing that is broadcast live on Facebook in English and on YouTube Live in Spanish. And this is also an opportunity for you to field your questions, to pose your questions. And if you have questions, please feel free to leave them in the comments area of the Facebook Live broadcast, or you can email them to us at publicaffairs@sonoma-county.org. That's public affairs, one word, @sonoma-county.org. And with that, let's go to Dr. Sundari Mase, Health Officer for the County of Sonoma, who has a few messages and some slides to go over before we take questions. Dr. Mase?
Great, thank you so much, Paul, and thanks everybody for joining us today. As you probably already know, Sonoma County remains in the purple tier under California's Blueprint for a Safer Economy. However, Sonoma County is requesting the state recalculate the data used to determine our tier status. On Wednesday, the county submitted an intent to request adjudication of our Blueprint for a Safer Economy metric to the California Department of Public Health. Based on the state's practices, laboratory results that are not electronically submitted have not counted towards the overall testing denominator. Just like every vote should count, every test should count. Counting all the laboratory results will likely result in a reduction of this week's test positivity metrics. The state is reviewing our request for adjudication and will inform the county if the application is approved at the beginning of next week. In other news, we want to announce that we've joined 9 Bay Area counties in issuing joint recommendations for staying safe during the holidays. These recommendations over travel gatherings, and steps you can take to reduce your risk. They are aligned with travel advisories issued today by California, Oregon, and Washington states. I'll be sharing more information on this holiday and travel guidance in an online video update on Monday, but for now, here are a few important highlights. Non-essential travel, including holiday travel, is not recommended. Travel outside the Bay Area increases your chances of getting infected and spreading the virus to others after you return. For those of you who choose to travel outside the Bay Area, it's strongly recommended that you self-quarantine for 14 days after you return if your activities put you at a higher risk of getting COVID-19. As you can see, COVID-19 numbers and rates are increasing in many states in the United States. So do take care that if you travel to a location with high numbers of COVID cases, that when you return, you consider self-quarantining. We also want you to keep gathering small, short, stable, and outdoors. Large meals with non-household members, including extended family or friends, increases the risk of getting and spreading COVID-19. Outdoor gatherings of no more than 12 people from no more than 3 households are allowed. Of course, we also encourage you to share meals and holiday traditions indoors with your household members. And don't forget all the other mitigation strategies such as the facial coverings, the social or physical distancing, and the general hygiene measures. So I'd now like to give you an update on the enhanced strategies that we implemented over the last few weeks. Let me pull up the slide presentation. Okay, can you see that all right, Paul?
Yes, it looks great. Thank you.
Okay, so this is our latest data of our tier status this week. We're in the purple with an adjusted case rate of 11.5, an overall testing positivity of 5.3%, and the testing positivity in the lowest quartile of 7%. So that has come down a little bit. You can go to the dashboard to take a look at the new way in which we're reflecting our metrics. All three of the metrics that count, that is. As I just mentioned, we are asking the state to reevaluate our tier status, accounting for those non-electronically transmitted records. When all those tests are counted, we may qualify for the red tier status, as it might bring down our overall testing positivity as well as our testing positivity in the lower quartile. If we can have both those metrics go into the orange, then we may qualify for the red tier. The state will consider this request and make a determination, which we'll know about in the beginning of next week. So what happens when we go into the red tier? Several changes can be implemented. Now, of course, we would stay in the red tier metrics for 2 weeks before we could actually go into the activities that are covered in the red tier. So if this week is accepted by the state, we need to remain in red tier metrics for next week. And then subsequent to that, we can consider opening activities as follows. Indoor with modifications at 50% capacity, all retail, shopping centers, that's malls, destination centers, swap meets can open at that capacity. Museums, zoos, aquariums could be open indoors with modifications at 25% capacity. Places of worship, movie theaters and restaurants can also be open indoors with modifications at 25% capacity, but a maximum of 100 people are allowed indoors. And then hotels and lodging are already open, but then they can open fitness centers within the hotels with modifications at 10% capacity, and gyms and fitness centers can also open at 10% capacity indoors with modifications, all the mitigation measures. So you may have been watching closely that many of the Bay Area counties and other counties throughout the state that have moved into the red tier or even into the orange tier are now seeing rises in their case numbers and are actually moving backwards a tier, either back into red or back into purple. So we need to focus on what we can all do, every single one of us, for once we do get into the red tier, for staying in the red tier. And that would really entail continuing all of our mitigation measures, staying at home if you're ill, consulting your doctor, getting tested if you're sick through your primary care physician, or getting tested if you think you may be at risk through one of our state-run sites, OptumServe, making sure that we're using our facial coverings or masks whenever indoors in places like grocery stores, hair salons, barbershops, that kind of thing, as well as wearing facial coverings whenever you're unable to socially or physically distance from people that you normally don't live with, even if outdoors, following all the general hygiene measures that have been discussed, making sure that you do keep that 6 foot of distance between you and non-household members whenever possible, and avoiding gatherings outside of the immediate household, which again is covered in our holiday guidance. And we will continue outreach to the community about all of these mitigation factors. We wanted to give a quick update on our contact tracing program. We're now getting about 79 new cases and 63 new contacts per day. And we are able to follow up quickly with each contact upon receipt of the new case and contacts. We've handled approximately 15,500 cases and contacts with a turnaround of 24 hours. And we have 78 people who are supporting contact investigation, contact tracing, 19 public health nurses and RNs supporting our outbreak investigation, complex case management tasks. Many of them are bilingual. Quick update on enforcement. We've had over 2,000 complaints received from the community since August 6th through November 3rd. About 1,270 are actionable complaints and 813 were commentary requesting information, that sort of thing. The most common types of complaints were around the use of masks. 538 complaints were about individuals not wearing masks. 367 complaints about businesses not following masking protocols, and 161 complaints about businesses operating indoors when they should not have been open indoors. And then we had 140 complaints about large gatherings. So again, each one of us can do our own piece to ensure that we're following all of the orders. Strategy 1, expanding testing opportunities. We have doubled our testing through public health, and we're focusing on those impacted neighborhoods in the lower quartile. And now we have pop-up testing about 12 times a week. We have been partnering with the COVID-19 Urgent Response and Aid Project to promote and support county testing events through their programs and through community outreach workers. We have been giving the $30 gift cards to encourage testing at pop-ups and to make up for people this time and effort coming to the pop-up testing. And we're continuing our daily contact testing at the public health lab and various other facilities. We're also partnering with our federally qualified health centers to provide more pop-up testing, and they'll all be testing 100 tests a day as well shortly. As I mentioned, the Cura Project are working with county and city leaders to develop strategies that strengthen access to services. They are providing a lot of information, culturally responsive information technology, inclusive and unified messaging. And when we do our pop-up testing through the county, the Cura Project comes to provide resources, provide information, PPE, hand sanitizer, and answer questions for people. Other outreach and education activities are happening at vineyards and other high-risk areas. As I said, the personal protective equipment is being distributed, and people who need to be connected to a medical home are being connected. We have given close to 1,500, this is probably more now with this week's distribution, gift cards that have been given to help offset the cost to individuals who are coming to take the tests. And we are have already given close to $165,000 for financial compensation or assistance. And we'll be starting the $1,216 per case in that lower quartile for their isolation period, and may actually extend that to people who quarantine as well. 408 individuals have been referred to the Cura Project for assistance, and 289 have been approved. We're also working very closely with our business community. I'm happy to hear that our business community is actually starting to provide a lot more education and outreach to their employees, and getting their employees tested through the state-run service, OptumServe in Windsor and in Santa Rosa, where businesses can make block appointments for their employees if they call 24 hours beforehand to ensure that everybody gets tested at least monthly. We're also partnering with the Economic Development Board to ensure that we're working on these enhanced strategies to support workforce and safe reopening. We have been working with our city managers and mayors, engaging businesses, and are sharing safety practices. And you can go to the SoCo emergency webpage soon for businesses. And of course, go to the Economic Development Board website to find out more information about how we're partnering with businesses and to get resources if you are a business. We're also securing additional hotel rooms. We've already contracted with hotel rooms in Sonoma. We're looking at doing so in Petaluma and Santa Rosa, Cloverdale, and other locations. We're also working with the state to leverage the Housing for Harvest program for agricultural workers who need housing during their isolation or quarantine periods, and providing mobile medical services and additional wraparound services, medication delivery, meal delivery, laundry services for people who are isolating or quarantining in our alternate care sites. And then Paul and his team have been very involved in a communication and education campaign, targeting communications specifically for that lower socioeconomic status quartile, about the expanded opportunities of testing and financial support, and of course, encouraging all residents in the community to follow safety protocols this holiday season. And you can see all the different activities that are currently in progress: a public service announcement campaign, ad series in the local print media, ads on Spanish TV and radio stations, digital billboard placements, social media posts during the holidays, and then door hangers and information access at convenience stores to give more information about COVID and all of the different resources available to people. So I'm going to go ahead and stop there, and we'll be okay taking questions now.
Great. Thank you, Dr. Mase. And just want to remind everybody that if you have questions, you're invited to do so. Those are members of the media. Please just go ahead and raise your hand and we'll go to you. And those in our audience, please submit your comments either in the Facebook Live comments area down below or email them to us at publicaffairs@sonoma-county.org. And I also want to let everybody know that we have with us today, I believe, is Dr. Baldwin with us today? Not today, I guess. I think she's on another call. But we do have Adam Radke, our Deputy County Counsel, and Kate Pack, our Health Program Manager of the Epidemiology team, who can get into the details of some of our testing results. So let's start with some questions from the public. One question, and this comes from a couple of different people, Dr. Mase. They're basically asking, I know that we're eager to get into the red, but one, Susan asked, do you still think the county should move from purple to red, considering the high numbers of new cases and deaths over the past 2 weeks and really across the country and the increase in the state?
Well, we're really basing our decisions on our data and what's happening here in our county. And that's why I really emphasize that if we do meet the metrics for the red tier, we need to do everything we can to stay in the red tier. We also have some other strategies that we're thinking of if we move into the red tier that we can implement to keep our community safe. Of course, if we also start seeing increasing trends in cases or numbers, then we'll have to respond appropriately to that.
Okay, and then we have a question from Darren, who runs a fitness gym, and he's really boiling down to just some clarifications that if in fact we are able by next week to move into the red, does that mean we need to wait another 2 weeks or before we actually are officially in the red? What's the timing on that?
Yeah, so you have to meet the metrics. In other words, have that test positivity, both the overall and the lower SES test positivity rate in the orange, with the new cases per day per 100,000 in the purple, or everything in the red for 2 weeks straight. So it would be after being in those metrics for 2 weeks, we could subsequently go into the red tier.
Okay, great. Thank you for clarifying that. Let's go to our media friends. Carrie Benefield from the Press Democrat. Carrie?
Hi, everybody. Adam, I think this question is for you. I don't feel like the state, the school waiver website is updated. I'm wondering if you can give me an updated rundown of what schools have applied for waivers and what schools have been granted waivers from the state. The state side doesn't seem to have been updated since the 4th.
You are correct. I did notice that earlier today as well. And I can say that the 4 applications that we submitted last week were all approved. So we now have 9 schools approved for reopening. The 4 new schools are Harvest Christian School, Redwood Adventist Academy, St. Eugene's Cathedral School, St. Francis Solano Catholic School. And then today we will also be referring to CDPH for approval Victory Christian Academy, which leaves 1, 2, 3, 6 more applications to finalize Spring Hill School, Windsor Christian Academy, Liberty School, St. Vincent de Paul, and then the new applications submitted by Bodega Bay School and Brush Creek Montessori School.
Okay. Super. Thank you so much, Adam.
Okay, let's go to Phil Barber from the Press Democrat. Phil?
Thanks, everyone. Dr. Mase, Dr. Galley and Dr. Pan from the state had a press conference this morning, and they didn't really mince words. They called what's going on in California now a surge. And they pointed not just to cases, but to hospitalizations and to ICU patients. What we're seeing in Sonoma County now, do you call it a surge? And are we seeing any increases in hospitalizations and ICU patients here?
And let me ask Kate to speak to the question of whether we're seeing an increase in ICU or hospitalizations. First, I don't think we are here in Sonoma in a surge. Kate, do you know, I think we're stable there, but do you know any more?
So currently our hospitalization and ICU rates are stable, and our case rate is stable as well.
Great. Dr. Mase, when you hear that, but you see what's going on, not only in California, but really across most of the country, is it just a matter of time until we see elevated rates and all that stuff here? Or do you think that we can forestall much of that through some of the safety precautions that you've outlined?
So that remains to be seen. What I can say is where we are right now, we're not seeing what other counties, some of the other counties in the state are seeing, or other states in the country. That doesn't mean to say that if, you know, we, either whether we move into the red or not, that we will, it's sort of what we need to see moving forward. And we hope that those mitigation strategies that I laid out would be effective in trying to mitigate the increase if that were to happen.
And then if I could ask one more question related to a potential surge. Obviously, we were like a lot of other places across the state and country in June, in that's when we kind of saw the first big surge, and it wasn't great. Are we better prepared now in Sonoma County to handle such a surge? And if so, in what ways?
Yeah, we've always been pretty well prepared because we've been planning in advance for any sort of surge. So even in June, I felt like we were relatively well prepared. And even now we are with the surge planning with all of our hospitals and our healthcare partners.
And last question on this, what about in terms of PPE? Is that situation generally better now than it was earlier in the pandemic? Are you satisfied with PPE levels in the county right now?
Definitely. I think we're in a good place with the PPE right now.
Great, thank you.
Okay, let's take a couple more questions from the public. This one kind of dovetails with Phil's question, really focusing on what's happening all around the world. And Andrea asked, I was wondering if you're aware of the second wave occurring in Europe. They actually have locked down their cities and have curfews in place. But one thing that stands out is they also have their schools are still open. The county health officials say they know children, they see children are not super spreaders of COVID, so their schools remain open. I guess they're asking what your thoughts are on that.
On the fact that schools remain open, can you repeat that?
That in Europe, that they're going through a second wave, but they've
Oh,
still
Europe.
decided
Mhm,
to keep their
mhm.
schools open. So the contrast is here, we've been keeping them closed.
Yeah, I mean, I think it's just, being a novel coronavirus, we don't really know the extent to which transmission is happening amongst young people versus older people. We do know that transmission does occur from kids, and that probably it's the adults that work with or live with the kids that are most at risk. So given that, I think that's why the decision on the state level is to keep schools closed, mainly to protect against further transmission to vulnerable populations.
And then another question, Kelly asked, why is tourism still being allowed in Sonoma County? She says it seems silly that we have people from all over the world coming to Sonoma County in a time of lockdown. Do you have thoughts on that?
Well, it's per the state order that applies statewide.
Yeah, we were trying to, so much of our economy is based on tourism, and we are trying to juggle all those needs. So, okay, let's go to Ted Williams from KZST. Ted?
Hey, thank you very much, Paul. Thank you, Dr. Mase. A couple of things I was thinking of, the case listings on the socoemergency.org website. You've dropped the active new cases. You just now have just new cases. Why did we drop the active portion of those?
I can defer to Kate to see.
Well, I can actually help answer that, Ted. It's Paul Gullickson. We are in the process of rejuggling and redesigning that page to make it more user-friendly, to really focus on the information that most impacts the county right now, and that's those key metrics. And so we're trying to decide where that data should go. And so those active cases as well as recoveries, we're going to relocate somewhere else because they're not as instrumental in terms of determining what tier we're in. So, but
Okay.
that's the
I was
main
thinking
reason.
that the active cases would really show, somebody whose infection is on the go at this point. Dr. Mase, maybe that's just something I haven't been very clear on, the difference between a new case and a new active case.
Any new case is considered an active case. Kate, is that correct?
Yep. So there's new cases, and then active cases are cases before they've been closed by public health.
Okay, because the numbers are different sometimes. You have new cases, you'll have 99 new cases, and you have 78 or active cases. I just wondered, that's the numbers I've been using on the air quite a bit.
Right. So the new case is the case that just got diagnosed that day. New cases per day, right? And then that after their 10-day isolation, they're no longer active. They're recovered. So then they go into the recovered category.
Okay, clear as mud. All right, and then on the 149 deaths that are listed out, do you think that those are all considered deaths by COVID, or do you think they're exacerbated by COVID with underlying conditions that may have caused their death? They just happen to have had COVID at the time they died.
Yeah, we're only putting in that number people who we believe the cause of death was COVID, in other words. So if they die and they died of something else and then they were found incidentally to have COVID, they're not put in that number.
Okay, thank you. And then one last thing, on the pop-up list that we have for public testing, we're not listing the Saturday ones, but there are Saturday ones. Can we get those added on there? Maybe that's a question for Paul, because you're working the style of those presentations.
Yeah, we'll definitely take that into account, Ted, and our redesign. There's a lot of data points, and it's interesting because there's certain ones people are interested in different data point. We want to make sure it's all out there, and the main purpose was just of our redesign is to focus on the ones that really impact where we in our standing on those metrics, but we'll make a point for that.
All right, thanks a lot. I'll let other people ask questions. Thank you, Dr. Mase. Thanks, Paul.
Okay. Dr. Mase, we have a question from Amelia, and a couple of people have asked about this, about our holiday guidance, where we're now asking people if they do travel this holiday season to self-isolate. Really, we're talking about quarantine. There is a difference between quarantining and isolation, but maybe you could talk about what that 14-day, what that looks like in terms of if people do travel outside the area.
Yeah, so it's based on the thing that if you're exposed to somebody with COVID, you have 14 days within which you can go on to getting COVID. And so if you were to travel somewhere and come back, the thought is that you would quarantine at home without leaving your house for the 14-day period. So maybe someone else can bring you groceries or that sort of thing, so that you, in case you are to become a case or become symptomatic during that 14 days, you're not out and about in the community or putting other people at risk. If you become symptomatic during that 14 days, that's when you need to contact your doctor and get tested for COVID. Now, at the end of the 14 days, if you're asymptomatic, you're fine and you can stop quarantining at that point.
Great, thank you. We have another question about will the Sebastopol Inn be used for COVID-19 housing as well as the Hotel Azura? Anne was asking, saying it's not clear if both properties have been purchased by the county as yet.
Yeah, I don't, Paul, maybe you can check on that. I'm not sure.
Yeah, well, the last time we heard, we are moving ahead as a county and purchasing the Hotel Zura in downtown Santa Rosa, but the Sebastopol Inn is still on the waiting list from last I heard. I don't know if Adam, if you have any different information at this point.
I don't have any different information.
Okay, thank you. And then what Anne asks, what can one do about stores that do not enforce mask wearing? Some people have noticed that they go into stores and they encounter a number of people who are not wearing masks. Even though they may have a sign out front, they're not really enforcing that. Any thoughts?
Well, we can give them the number to call, I suppose.
Yeah. Yeah, so if people do have concerns about practices at a business, they can call the number for our tip line for our code enforcement ordinance. It's 1-833-SAFE-707. That's 1-833-SAFE-707. Or you can email a concern to safe707@sonoma-county.org. And with those will be referred, and the code enforcement officer will go out and talk to them, or it will be referred to the jurisdiction. If it's in an incorporated city, then the city will take action on that. So, okay, let's go back. Phil, do you have a follow-up question?
I do have just one, and I apologize. I know it's been a long session, Dr. Mase, but I just wanted to make sure I understood one thing. You've asked the state to consider testing results from a wider number of labs than it has been. And I'm just wondering, why do you think would that make our rates look better? Would the rates from those private labs not be similar or equivalent to the data that the state is already getting?
Well, it's just that all those tests that are being done, and the majority are going to be negative because they're testing the community. And all those tests are not now being counted in the denominator because they're not electronically going through the state. So basically it's like similar to us increasing our testing ourselves because we want to widely test people to find cases, of course, but also because that will decrease our test positivity over time, if that makes sense.
And that's because the tests that the county itself is sending, they tend to have a higher rate because of the contact tracing and things like that.
Yeah, exactly. So that we do priority testing.
Yeah.
It's the highest risk populations. Like the contacts, I think somewhere upwards of 30% of our contacts are positive. And then we also are doing all of that testing in the highest hit populations, like that lower socioeconomic status, those areas where there is more transmission and higher rates. So all the testing we do at our public health lab is going to have a very much higher positivity rate. OptumServe, on the other hand, which is a state-run service in Santa Rosa and was in Petaluma, now in Windsor, the test positivity rate is actually less than 1%. So it means that the people that are going there to get tested are wanting to know their status or worried about some exposure, but they're not the symptomatic people or the really people in the skilled nursing facilities and things like that. So similarly, there's other labs performing testing like OptumServe, but they're not electronically sending their data through. And so they're not counted by the state, and that's a statewide phenomenon for every county.
That's a big help. Thank you.
Okay, Kathy online asks, is there anything being done with the skilled nursing homes and residential homes? We know there was a concern about that for a while. She says, I haven't heard much about what's going on in the skilled nursing facilities.
Yeah, well, fortunately, the numbers of cases in those congregate settings is really down. I mean, we are seeing just a handful of cases every week now. And so we feel like we've had a really good intervention with the congregate centers. In other words, they've had a lot of education about infection control practices, both from the county and the state, and they're doing their ongoing surveillance testing of their staff and trying to ensure that anyone who's sick stays at home. They're doing all the best practices now. And so I think we're in a much better place with those congregate settings.
Okay, and Judy asks, she's asking, where can we get a test with a quick turnaround time? She said she just took one and it took 6 days. I had heard that they were much faster these days. I know my son had one and got his results in 3 days. So
I think it's still somewhat variable. If you are sick, you should go see your doctor. That's the fastest way for you to get tested and get a result. If you're not ill, but you feel like you are concerned for whatever reason, then it's totally reasonable to go to OptumServe, even with a 6-day turnaround time.
Yeah. And we have quite a number of questions concerning the fact that our schools are still in distance learning. And I think it is important just to remind people that we are operating under the state health order in that area, and we are in purple. And we want schools to open as quickly as anybody does, but that is not an option for us. We can't independently, Dr. Mase can't independently just recommend that they be reopened. They have to go through a waiver process. But Dr. Mase, maybe you could talk about once we go into red, what's the situation with schools? I think you said that they could start to reopen.
Well, I think Adam can give that timeline most accurately.
Yes. So what the state order says is that when the county is in the red tier for 14 days, then all schools, this would include high schools, middle schools, elementary schools, private, public charter, any of those schools may reopen under the schools reopening guidance. But this is 14 days after the county is in the red tier, provided that it stays in the red tier, obviously after 14 days.
Yeah, and as I understand, they still have to have a plan in place for how they're going to manage safely. And I know that's been an obstacle for some of our public schools and having that set up.
Correct. And there would be regular routine surveillance testing that would be required. I know SCO is working with a lot of public schools on that, and private schools are also working to address that as well, either through their own reopening plans or through the waiver process.
Okay. Okay, on that note, let's go to Carrie Benefield. She has a follow-up question. Carrie?
Yeah, thank you. Just on that last question that Adam was addressing, I was wondering if we could get a little bit more information on, Adam, you mentioned high schools and secondary schools, that seems to me a sticking point for a lot of campuses because of cohorts and changing classes. Is that going to be possible for public schools to go to math, English, and history in one day with 15 or 16 kids per class? Is that going to be possible?
I believe Dr. Mase will be recommending that classes such as in secondary schools, high schools, be done in a no more than 2 cohorts per day, and where they switch off after a couple of days. I believe she's working with SCO on how to effectuate that in a way that so that they're not commingling with more than 2 cohorts at any time. But that is difficult, and that is something we're planning for.
Okay. All right. Thank you.
Sorry. With that, I think we're going to call this a wrap for today. It is Friday afternoon, about 4:15. So I just want to thank all of those behind the scenes, including Stuart, our producer, Elizabeth, our sign language interpreter, Jordy, our Spanish language interpreter, and Sylvia, who is managing our Spanish language recording. And I want to thank all of you for joining us, and particularly Dr. Mase for being here, and all of our staff. We invite you to join us for our next community briefing, which will be on Wednesday, November 18th, where we hope to give you an update on our efforts to move us from the purple tier into the red. Until then, we wish you all a good weekend and encourage you to drive safely. It is wet out there, finally. So thank you very much.
Thank you.